Behavior Intervention Plan for Special Needs Student. Introduction. Special needs education focuses on helping children who have challenges in their social and emotional lives. Therefore, a child's life is dependent on social skill development to help them succeed in almost all spheres of existence. Psychologists often utilize the basics of play therapy to observe and assess a youngster's natural setting. This technique is significant for early learning as it leads to the teenager's social, emotional, and cognitive well-being. Although most social skills can be taught, some kids need a personalized and well-planned approach accompanied by an intervention plan to satisfy the child's requirements. As such, behavior intervention plans for this group of people reward and strengthen positive behavior. This paper focuses on developing an appropriate behavior intervention plan for addressing Sarah's social and expressive communication challenges. Main body. In observable terms, Sarah has exhibited various target behaviors are indicated in the context. For example, Sarah has particularly shown that she faces social and psychological development challenges, expressive communication, and play skills. The patient demonstrates various difficulties in interactions, especially with peers, and sometimes Sarah displays aggressive behavior towards her peers. While Sarah may not be aware of the contexts of her habits, there are several antecedents and consequences related to her behavior. For example, since the patient is attached to her doll, she sometimes displays aggression when her peers take her preferred toy. The consequences of Sarah's behaviors can be seen in low educational attainment and detrimental effects on her brain development. These repercussions are particularly attributed to Sarah's social isolation. Therefore, the objective of this intervention plan would be to enable Sarah to improve her social, emotional, and expressive communication in an attempt to enhance her play skills. The desired behavior for Sarah would be for her to actively participate in child development activities such as interacting with her peers. The patient should participate in activities that improve her verbal communication skills. As such, the function of this behavior will help Sarah gain communication skills as a replacement for her aggressive nature, strengthen her play skills, and use language to bolster her independence. The replacement behavior identified for helping Sarah improve her social and communication skills would help them follow their interests. Sarah's challenges can be addressed by incorporating various improvements in her classroom environment. For example, the teacher can consider developing a play therapy session that is specifically personalized based on Sarah's profile. Therefore, adult-child interactions can be reinforced to become more supportive by using positive language, giving children choices, following their lead, and supporting their parents. The specific skill development for Sarah should focus on improving their social and interpersonal skills. A comprehensive step-by-step intervention plan was identified to help Sarah should focus on improving her social and communication skills. For example, the teacher should consider designing social supports such as monitoring, allowing the child to participate in extracurricular activities, and facilitating positive connections with other children. The positive guidance strategies identified to address the preferred behavior are proximity control and systematic prompting. Moreover, Sarah's progress can be monitored using a check-and-connect program and a check-in/check-out (CICO) technique. Lastly, the final step would be to get Sarah's parents involved in her intervention plan. In particular, the teacher should consider designing a parent-teacher communication system that utilizes technology such as a class dojo. Conclusion. In conclusion, this paper has developed an appropriate intervention plan for addressing the social and expressive communication challenges affecting Sarah. Therefore, specific groups of children will always require special intervention plans, specifically modified to suit their unique needs. In Sarah's case, the child faces various challenges that limit her from interacting with her peers. In particular, this behavior involvement initiative has incorporated antecedent and consequence strategies to formulate a plan for helping Sarah.